Welcome. This is Conversations with Black Doctors, brought to you by Austin Black Physicians Association, also known as ABPA. The mission of the Austin Black Physician Association is to improve health disparities within our community and to inspire and nurture the next generation of Black doctors. The purpose of these webinars is to bring health information to our community from trusted voices in the Austin area. We want everyone to have the knowledge to care for themselves in the best ways possible. If you're interested in learning more about or collaborating with ABPA, please visit austinbpa.com. That's austinbpa.com. And please feel free to share.
Thank you for joining us. With me today is Dr. Eno Ashin, an adolescent medicine physician and a new member of the Austin Black Physician Association. Dr. Ashin, would you please introduce yourself? Tell us a little bit about who you are and what we're going to talk about today.
My name is Dr. Eno Ashin, as Dr. Hutchinson mentioned. I am an adolescent medicine specialist. Just a little bit about myself. I am Nigerian, but spent the majority of my time in New York, sometime in Houston, Texas, and I am currently practicing in Temple, Texas as well. Today, we're going to be talking about eating disorders as it pertains to not just patients as a whole, but just adolescents and our teenagers, especially because since the pandemic started, we've seen a steep rise in new incidences and cases of eating disorders. And we thought that this would be a good topic to kind of address today, to give you, our audience, just some things to look out for, and also for parents as well, just some things to look out for if you have concerns or questions, just kind of knowing the right questions to ask.
I am so grateful that you're here with us today. And just like you said, this last almost 2 years have been very difficult. The stresses have been through the roof. And we've seen more and more needs from our patients from mental health, not only eating disorders, but anxiety and depression and things like that. And so it's great to have you today so we can talk a little bit about what parents should look for, what teens can do, just what we can do as a community to make things better. So maybe let me start with that question. Say I have a parent who has noticed that their most of the time daughter, but it can be son too, doesn't seem to be quite eating the way that they think they should be. What are some things that a parent should look for?
So from a parent's perspective, when we talk about eating disorders, there are different types. And I think the most common type that usually the layman is aware of is anorexia nervosa, because that's kind of like what's been in the media, what people talk about, which is where the person's like concerned about how they physically look, and they worry about, like, they start going through the phases of like restricting what they eat or counting calories or exercising excessively. So that's kind of like your typical anorexia nervosa that everyone's aware about, that we've all seen movies about. And then you have the second type, which is like the binge purge type, which is the person who eats a ton of food in a short period of time, and then they feel guilty afterwards or feel really bad, and then they engage in some type of compensatory behavior, which would be either exercising or going to the bathroom to purge. That could be either inducing vomiting or taking a diuretic, so like water pill to like force them to pee a ton, or maybe even taking laxatives. So as soon as they eat, they go to the bathroom and they purge it out. So that's kind of like the most common one. So a lot of the times parents will notice like their child is not eating as much as everyone else. All of a sudden a child who has been eating fine, and all of a sudden they're like, I can't eat that. Oh, it's too many calories, it's too many carbs, and they will start saying things like that. And then the parents will notice like a child who eats, and then as soon as they're done with dinner or lunch, they're like right in the bathroom and in the bathroom for a bit. Or they would eat, and then as soon as they're done eating, they're going to like exercise for like 2 hours at a time, or they're in their bedroom doing like 200 crunches, because they have to, in their mind, it's like, if I've eaten 500 calories, I have to burn 500 calories. So that's kind of like the most common one. The other one we're starting to see a lot more, and this is like a new diagnosis as of 2011, it's called ARFID. So this is the kid who's not really worried about how they look, but this is the teenager who's always been a picky eater as a child. And then now they're an adult, they're like a teenager, they're in their teenage, and they're like, sometimes is a type of kid who's very high, very driven, and they would be so busy and forget to eat. And the parents will notice like their child is losing weight and they just don't remember to eat. Or when they eat, they're like, oh, I'm so full, my belly hurts, I can't eat anymore, and they just stop eating. So like getting full very quickly is one of the signs to look for. And then speaking for our fed, the other ones are the kids who either got sick recently or had a family member was sick around them or a friend, or they were ate and choked on the food and almost passed out or something like that, or had a really bad bug and every time they eat, they got sick. So now they don't want to eat because they're scared of what will happen if they eat. So that's another type of RFID. So that's another thing we'll see where parents will say, my kid all of a sudden doesn't want to eat and they're terrified of eating. And that comes with a lot of anxiety just surrounding the thought of eating. And then lastly, you have the ones who, it's not the restriction, it's more, and we see, sometimes you see this a lot too with autism, kids who have autism, where it's more texture. There's a thing with texture where they're like, oh, I don't want to eat that because it tastes mushy. Or they just have certain foods they don't eat, like they won't eat yogurt, they won't eat mashed potatoes because it feels weird in their mouth. So kind of like those are the kind of things to look for. And sometimes the pediatrician will notice that, oh, the child has been slowly falling off their weight curve. And depends, and we bring it to the parents, and the parents, oh yeah, I noticed the child has been doing this or they've been doing that. And I think one of the big one that I've been seeing recently too, for just for parents to keep a mind, keep in front of their minds, and just for physicians as well, is the child who's always been obese, and then the physician has been saying, you're overweight, you're overweight, you're overweight. And then the child's losing weight and everyone's like, go, you're doing it. And they're like cheering the kid on. But then the kid has lost 13% of their total body weight in a very short period of time. And that's kind of like your typical anorexia patient that nobody really knows that this child, yes, they might be losing weight, but they're doing it in a healthy way. And that's the ones we actually need to look out for.
Fantastic. You've given us a lot of good information all at one time. One of the points I want to just reiterate is that there's not one type of eating disorder. There are a lot of different things that parents need to look out for. And the difference between something that's happened recently or the child who's had problems for most of their life. And those are good ways to distinguish when you come to see us or talk to your doctor about concerns for your child's eating. You also touched on something that I want to emphasize and get you to talk a little bit more about. When people hear about eating disorders, they always think it's a skinny child. They always think it's someone who looks thinner than they're supposed to look. But we both know that they may not be thin. They may have just lost a lot from where they were before. Can you talk to us a little bit more about how parents should look at their child who doesn't look skinny as possibly having an eating disorder?
So for those children who are not really skinny, the doctors have always talked about how they've been overweight and they need to be healthy. And everyone talks about how they need to be healthy. And I know just culturally, sometimes we tend to play about like, oh, you look chubby, you're looking chubby around the waist and things like that. And then teenagers, especially because of the age we live in, the social media age where everything is all about how you look, can internalize some of these things. So some of the things to look for in this particular type of kids are the ones who are all of a sudden become withdrawn. So you have a child who's very sociable, now all of a sudden they don't want to talk to anybody, they're isolating themselves. And then you start noticing that the child doesn't want to eat. And they're like, oh, I'm not hungry. They've gone from not being hungry all the time and now they're not hungry. And then there's this sense of wanting to eat overly healthy food all of a sudden. And you'll see that in kids where, and sometimes parents might not even notice it. And even us as physicians sometimes will miss it because you've been seeing the child for obesity and now the child's losing weight. So things to look out for is like those behaviors, like isolating, not really being who they are, just from a mood perspective, just being a little bit more withdrawn. And then other things just from physical symptoms that we look out for as well, which is one of the reasons why a patient like that might come to our attention is they start becoming really tired, right? So when you're malnourished, so that being malnourished doesn't mean you have to be like super skinny. If you lose a ton of weight over time, your body's breaking down muscle, it's breaking down the heart muscle and things like that. So just being tired all of a sudden is like, they can't stay awake. Now they're getting out of breath and they go up a flight of stairs and they're like really out of breath. and that's because they're malnourished. Other things to look up for is kind of like if you start to see swelling that you can't really explain, and sometimes you see it around the face, you might see it around the legs, and even some bruising around the knuckles. We call it Russell signs. If a child who's inducing vomiting after they eat. So those are like specific things that parents could try to look out for. And if something doesn't feel right, usually something's going on, and it's just best to bring it to the attention of the pediatrician or the doctor.
Perfect. Yes, you gave some great tips as to what parents can look for, help identify when their child is not being as healthy as they could. And what I always love to emphasize is trust your instincts. If you think something is wrong, you should let someone know. Talk to your physician, talk to your nurse practitioner, talk to someone to ask them those questions. So let's say that a parent has brought up the concern that they're worried. What are some things they can do before they go in to see somebody?
So one thing, if you're concerned that your child has an eating disorder, the number one thing I tell parents is, if your child has a full-length mirror in their bedroom, take it away, because that's the number one thing they're focusing on. Your child is spending a lot of time during the day thinking about what they're going to eat, how much calories they're going to need, how many hours they're going to exercise, how many, so it's so obsessive. So one of the things I tell parents is get the mirror out of the room. I understand if there's a mirror in the bathroom, you can't take that out, but ensuring that your child doesn't spend too much time in the bathroom. Those are some things you can do. And then the other thing too is if you find that your child is always weighing themselves, if you have a scale in the home, put it away in a place where they can find it. So that way, when you get to the doctor, you can then tell the doctor, like, because sometimes some people might not even know to ask those questions. You can tell the doctor, like, I notice my child is always weighing themselves after they eat, or they're always in the bathroom and they're in the bathroom taking a shower for like 30 minutes and things like that.
Some of the young people also have an obsession with food too. They'll prepare food, they'll do a lot of things around food, they'll talk about food, but they're not eating. Is there anything that you talk to parents about that when they notice that behavior? Should they keep them out of the kitchen? Should they encourage them to cook more? What do you tell a parent with a child who seems to be fixated upon food?
I think if the child is fixated upon food, it's helpful to get the parents involved, because then you can then help in directing what's healthy behavior. So a lot of the times you'll see a child who has an eating disorder who's so focused on it has to be a certain number of cups that goes when you're cooking. So if it's becoming disruptive during dinner time where they absolutely are like controlling, like, oh, you already said you were only going to do a cup of butter and now you're putting 2 cups of butter, like kick them out of the kitchen, obviously, because that's disruptive. But if it's a child who's not doing that, but just kind of like, it's helpful to have them help you make the food, but any behaviors that can be seen as disruptive or obsessive, I say redirect. And if that doesn't work, just get them out of that space. And then when you're done, you can bring them back into the kitchen and then have the parents or someone sit down and eat with the child. So that way you can observe those behaviors that are usually anxiety provoking surrounding meals. The other thing I also say is you can do meal planning with a child. So if it's a child who's like so obsessive of how much they're eating, do a meal plan for the week where you sit down and say, okay, I know this is causing a lot of stress for you. Why don't we go through and figure out what we're going to eat this week? And then you do some meal planning together. You figure out what you're buying for groceries. And then that way the child feels like, okay, I've had some input, but then they're not in the kitchen with you where they're being disruptive.
Outstanding. Okay, so parents identify the problem. They may have tried a few things and they've given it time. Now they come in to see you. What are some things that you might ask the parent or talk to the family about for that first visit?
So for the first visit, just to give some parents a heads up, we always do what we call blind weight, and it's a dry weight. So there are so many ways online on how kids can do different things to kind of trick physicians and providers to get their weight to be higher than it is. So something you might see, which might be different from your regular visits, is normally your child comes in and your child gets weighed and their clothes on and everything. But if we are concerned about an eating disorder and we know beforehand, your child will be weighed after they would have to go to the bathroom, pee first, then come back into the room, disrobe and put on the back, like the hospital gown, and be weighed in the hospital gown, because that gives us that ensures that your child is not hiding anything in their pockets to increase their weight or things like that. And you will not be told your child's weight. Your child will not be told your weight. The other thing I also do too, sometimes I don't even put it in the note. I will tell parents later the percent BMI or total like percent ideal body weight their child falls under, because I don't want, the goal is to not have the parent or the child focus on a specific number. The goal is for your child to be overall healthy. So that's kind of like the different things you might see where your child is now gone from getting their weight done in clothes, but now they're not having their weight done in a hospital gown. It's blinded, which means you will not know, your child would not know. They would have to pee first. And then the last thing we do what we call orthostatic vital signs, which means they would have to lay down, get their blood pressure and heart rate taken, have them stand for a little bit, and we'll repeat the blood pressure and heart rate again. And what that tells us is how your heart, the child's heart is functioning. Because normally when we stand, your blood pressure goes up for a little bit and then it comes down. For kids who are malnourished, it stays up a little longer. So that kind of just tells us how sick your child is. So these are some things that might be different from your regular visit that you've had in the past.
That's great. Those are great points, because a lot of times parents and young people are afraid to come in because of being judged and because they're not sure what's going to happen. So that's a very nice breakdown of kind of the routine that happens from that very first visit.
Mm-hmm.
Can you also share with the audience a little bit the fact that this is a team effort, that it's not just one person to make a difference and it takes an entire team? Can you talk about who the team is that you consider part of the treatment team for a young person with an eating disorder?
So the team, like as you mentioned, treating eating disorders, it is a mental health diagnosis, but it requires a team. So depending on the setting that you're in, you might have a pediatrician who's the one taking care of your child primarily from a medical perspective, or it might be an adolescent medicine specialist, someone like me or Dr. Hutchinson. So you need a medical provider, preferably a doctor, and then you have a dietitian, so a registered dietitian who will help you with meal planning and see your child more often, depending on how sick they are. And then you also need a therapist, and the therapist kind of helps your child deal with those constant eating disorder thoughts that are obsessive and intrusive, with those behaviors, and just kind of giving them the coping skills on how to deal with those thoughts. Because the thoughts will always be there. For some people, eating disorder diagnosis is a lifetime diagnosis. For others, it's short-term and goes away. But just making sure that the child is equipped with the right tools to deal with those thoughts and deal with those obsessions when they do come. The therapist is also there to also provide family therapy alongside individual therapy, because for some parents, it can be very overwhelming just because of the stigma that goes with an eating disorder diagnosis. So the therapist is there to kind of help the family navigate how to have conversations, what kind of topics to avoid in the home. If they have other kids in the home, now meal times might be a little bit different, how to explain to those kids, like, this is the reason why things are different. So the therapist it's there to really help your child cope, and the family as well. And then the last piece is a psychiatrist. Because eating disorders is a mental health diagnosis, there are a lot of co-diagnoses that go with eating disorder. So a lot of kids will also have like OCD along with that. They will have anxiety and depression with that. And some of that does require medical management, and that's where the psychiatrist comes in.
Perfect. You mentioned stigma, and I'd love to hear your thoughts about if there are any differences in the Black community with eating disorders. Do you think that a different approach is warranted? Do you think there are any differences that we should be aware of when thinking about Black kids with eating disorders?
I think in the Black community, just in the last few years, when it comes to eating disorders, I don't think it's more of a stigma. I think it's more surrounding the anxiety, other comorbidities that goes along with it, the anxiety and the depression part. It's like, why do you have an issue with food? Why can't you just eat, right? So it's like, we should be able to eat. It's not a problem, right? Or if you have some people who live in food deserts, and it's like, you don't even have enough to begin with, and now you're talking about you don't want to eat. Or if it's a kid who comes from a family where all the women have figure eights, right? It's curvaceous, and this one child doesn't. And when everyone goes out, that's what everyone talks about. And now this child is being forced to deal with the reality of, oh, I'm not pretty enough, or nobody will find me attractive, kind of thing. So I think from that perspective too, is just kind of like letting parents know that it's okay for your child to have a mental health diagnosis. Like, we have to get away from that stigma of, oh, they're fine, they're just being skinny, or they're skinny and they look healthy. It's not a problem. It is a problem, because your child can die from an eating disorder diagnosis. Like, I know eating disorder is the second most common cause of death with a psych diagnosis. So it is serious. So I think as a community, it's really just thinking of it as a whole from a mental health perspective, where it's okay to ask for help and it's okay to ask questions. I think one thing that I find is, especially not just for in the Black community, just for like my minorities, where a lot of us don't ask questions. So like, I will sometimes in my clinic, I will sit down and like list a whole slew of things, and I'm expecting the parents to ask questions, and no one's asking me questions. Like, please ask me questions, or at least argue with me or disagree with me at some point, because you're there to advocate for your child. I'm there to take care of your child. We're there to make sure your child is healthy. But we want you to, even if you don't know. And sometimes we get busy, we forget to provide you with resources. Ask for resources. If something doesn't make sense, ask again. If you get home and it doesn't make sense, call the doctor and ask again. And I think by so doing, we're empowering everyone else to advocate for ourselves, to make sure that we're getting the right health care that we need.
You segued perfectly into my next to last question, resources. What can you tell our audience, or where can they go to find help if they have more questions or they want to know more? What resources can you share right now?
So there are a few resources out there. Just a few on the top of my head. The Academy of Eating Disorders. They are responsible for creating some guidelines. They have some excellent resources on their website. That's one place I would go. There's another website called the National Eating Disorders Association, neta.org. Is a great resource where you can go in, put in your zip code, and find therapists and psychiatrists based on where you're located to see if you have providers in the area. And at the end of the day, like, if you're in a place where you just don't know where to start, talk to your providers, talk to your doctor, talk to your pediatrician. Because even if the pediatrician is uncomfortable in seeing your child, or if there's a concern for eating disorder diagnosis, they can help to direct you to get the right care that you need.
Outstanding. This has been wonderful. Do you have anything else you'd like to share or mention before we go?
I do want to say that just lastly, that eating disorders diagnosis does not discriminate. It comes in all body shapes and form and color. If you're ever concerned that your child has an eating disorder diagnosis, do not be worried. Do not hesitate to bring that up to the attention of your pediatrician or your doctor, or maybe you might be able to reach out to one of us as well.
Great. Thank you so much, Dr. Ashin. We're so grateful for your time and your expertise. We also want to thank you, our audience, for listening in wherever you are. ABPA wants to continue to further its mission to improve health disparities within our community and inspire and nurture the next generation of Black doctors. Please leave comments or send an email to info@austinbpa.com and visit our website at austinbpa.com. If you or your organization want to partner with us, if you have questions, if you want to just reach out and let us know what topics you'd like us to address, we'd love to hear from you. Again, thank you and have a wonderful day.
Thank you for having me.